The Really podcast is intended for entertainment purposes only. The views, information, opinions, and beliefs expressed in the Really podcast are solely those of its host, Reverend A.D. Black, and his guests, and do not necessarily represent the views, opinions, and beliefs of the Really podcast production team, sponsors, or affiliates. Any advertising incorporated into, reproduction, distribution, editing, or modification of this podcast without the expressed written approval of the Really podcast host is strictly prohibited. Reverend A.D. Black assumes no liability for any unauthorized activities in connection with the use of this podcast.
Ladies and gentlemen, welcome to the podcast, Really, the podcast where we discuss topics and events that need clarity. In other words, make it make sense. You didn't really think we were just going to take your word for it, did you? I am your host this morning, Reverend A.D. Black, and we're bringing something that I wanted to get it to you as soon as possible. In the new year, I think in January, but we'll clear it up with our guest this morning, things will change for Medicaid and Medicare. Things will change for that. You're talking about your prescriptions going up. You wait till you hear what this gentleman has to say about Medicaid and Medicare. Are you sure you have the right one? No, you couldn't possibly be sure. I'm not even sure I have the right one. But we're going to be sure after this podcast, you're going to know what you need, how to go about getting it, and what it covers. So this morning, we're going to bring on Mr. Mike Lee, who's no stranger to you. We've had him on before talking about insurance, and now he's talking about Medicaid and Medicare, trying to make sure that our people have the right one. Because trust me, the reason they're fighting over Medicaid and Medicare is because that can get expensive. An operation for you or your spouse can wipe out your life savings if you don't have the right one. So without further ado, here he goes, Mr. Mike Lee, with Medicaid and Medicare, what it does and how it changes in the beginning of the year. God bless you. Talk to you soon. Good morning, Mr. Lee.
Good morning. Good morning. How you doing?
Good morning. Welcome to the Really podcast, where people are excited about this. When you told me about it, I immediately want to get you on to discuss Medicaid and Medicare and what we don't have, what we think we do have. We may have the wrong thing. And so I've been talking about it at the barber shop and at work. And a lot of people want to hear you speak on this subject. I personally want to hear you speak on the subject to make sure that I have what I'm supposed to have. Because if I'm not mistaken, all this takes place at the first of the year, correct?
Yes, sir.
And so we are looking forward to hearing what you have to say, and so that God's people can get what they have. I'm surprised that a lot of people don't know what's coming, or they don't know how bad it is of what's coming. So without further ado, let's get into it, man. Tell me what we should have, what's getting ready to happen, and the information that we have to get to.
Yes, sir. So first things first, I want to just thank you guys for allowing me to just come and bring value to the marketplace. You know, I'm very grateful. I am a first generation college graduate. You know, I studied finance, I majored in finance, minored in psychology. I tried to do everything the right way. I went to school, I got good grades. And what I do personally, my vision is I go and I take all this prevalent information that I get from these conferences and from these people, and I bring it right back to the crib.
Amen.
I bring it right back to us because no one's in a rush to come and educate us on a lot of these things that I traditionally talk about. Okay, so today, what I'm going to be talking about specifically is Medicare and Medicaid. Most people, and when I say most people, I mean most people, don't realize the changes that are coming for 2026. Okay, you're going to be late to the show. How do I know that most people don't know? Because we just found out about the major changes that's happening in 2026. And it's our job to have our ears to the ground, right? So, two things I want to make note of right now. Number one, you have to know people before you need people.
Amen. Yes, sir.
Okay. Got to know people before you need them. If your car is messed up and you know a mechanic, that is going to save you money. If you don't know that mechanic before you need them, you're going to have to go down to the mechanic. You're going to have to go down to the dealership. You're going to have to pay full price.
You don't want to do that. I've been there.
You don't want to do that. Okay. So that's the first thing. You got to know people before you need people. The second thing is sometimes you got to be the adult. Okay. And what do I mean by that? That means sometimes you're going to be hearing information that is so good that everybody needs to know.
Yeah.
Sometimes you're going to be hearing information that's so good that you need to tell your best friend, you need to tell your mama, you need to tell your sister, you need to tell the people at your church because they can be affected by it as well. So what I tell people to do is we want you to be a river and not a dam,
Okay.
meaning we want information to flow through you and not just to you.
Yes, sir.
Okay. Okay. Some of the information that I'm going to be telling you, over 1.5 million people in this area are going to be affected by it. Okay. So, with that being said, let me break this Medicare thing all the way down. Okay. And whenever we have these seminars that we have are usually an hour long, an hour and a half long. These are people that are asking questions. The first 20, 30 minutes of our seminars applies to everybody. From there, I'm just telling y'all now, Medicare is different for every individual. For everybody, it's different. It's different based on your zip code. It's different based on how you retired. Did you retire from the federal government? Did you retire military? Did you retire private? Did you retire from the county? Did you retire from the state? Everything is going to be different. So what I'm going to do at the end of this, I'm going to make sure you guys have my phone number so that you can get all the information that you need. Okay. The other thing, we have a proprietary software that tells us all of the Medicare programs that are available. It doesn't matter if you call 1-800-Medicare. It doesn't matter if you go to Medicare.com. The exact same thing that you're going to get from them is the exact same thing that you'll get from someone like me. The difference is when you have questions, you got somebody that you know.
Amen.
You got questions, you don't have to call a 1-800 number and talk to somebody who can't pick up where y'all left off. You can have a relationship with someone who knows what they're talking about. All right. Got that out the way. With that being said, Medicare is very, very complicated. Not just for you, so don't feel bad. It is complicated for everybody. It is complicated for us professionals. It is complicated for absolutely everybody. However, it is required. Okay, so here's where if you're taking notes, here's where you want to start taking notes. Medicare is required for anybody that is over the age of 65 in the United States.
Okay.
You can get Medicare 3 months before your 65th birthday. You can get Medicare the month of your 65th birthday, and you can get Medicare 3 months after your 65th birthday. If you don't get it within that time frame, you are going to be penalized. Okay? You're going to be penalized unless you have what's called credible coverage. Credible coverage means that you work at a job that has at least 20 employees and they're providing healthcare insurance for you. Once you leave that job, you have to go and get a Medicare program. Okay? Otherwise, you will be penalized. The thing about that penalty is it never falls off. It never falls off. Okay. I got a client who retired at age 65, never got Medicare. He didn't end up getting Medicare until he was about 71. And that 10% penalty every year
Yes, sir.
has increased. So he's at the 60% that he's overpaying for Medicare and it's never going to fall off.
Wow. Come on now.
Yes. So that's number one. If you are 65, if you know someone who is about to be 65, please let them know that they need to have a discussion with a professional. Okay. Now, when you get Medicare, you have Part A and Part B. Okay, most people, you get that red, white, and blue card in the mail. Okay, got the long numbers and all that stuff. That takes care of Part A and Part B of your Medicare. Okay, Part A is hospitalizations when you go to the hospital and things like that. Part B is when you go to your doctors, your primary care physicians, your specialists, and things like that. Okay. Part A of Medicare is what you have been paying for since you've had your first job. Okay, so when you got your check in the mail and it had that little $20 off, $20 removed, or $60 removed,
Okay.
that was paying for Medicare for this time frame when you turn 65. Okay. Part B, in 2025, you were paying $185 per month for your Part B. That is how much it costs across the country, $185 per month. In 2026, it is one of the largest increases in recent history. Instead of it being $185 per month for your Part B, it is going to be $206.50. Okay, so $21.50 increase from what it was last year. Okay, I want everybody to be prepared for this stuff. A lot of this stuff, I'm just telling y'all, it's going to be a completely surprise to people. Okay, for those people that aren't already on Medicare or you just want to understand Medicare a little bit deeper, this $206.50 is traditionally going to come directly out of your Social Security check. Okay.
Mm.
If it's not coming out of your Social Security check or your retirement check, then they will send you a bill in the mail every 3 months. All right. Now, what else do we need to look out for when it comes to retirement, Part B, and things like that? Well, here's the thing. When you retire, the government, let's say you retire at age 67. I'm just going to give some examples so you guys can understand what I'm saying. When you retire, the government is going to look back 2 years at your income, and that is what they're going to charge you your Part B based on. Okay. Why is that important? Well, because we got a lot of people who work for the federal government here. They made good money, $100,000, $120,000, $140,000. And when they retire, the government is going to look back at what they were making 2 years ago. Why is that important? Because if you make more than $106,000, then your Part B isn't going to be 206.50. It's going to be more based on the income that you have. So if you were somebody who made $200,000, your Part B is going to cost more than the people that made $50,000 or $70,000 or $100,000.
Okay.
You make $500,000, it's going to be more than the people that make $200,000. Why am I mentioning this? Well, the reason I'm mentioning this is because when people retire, they're usually making less money.
Amen. Yes.
Yes, I was making $120,000.
Exactly.
But now that I'm retired, I'm making $65,000. I'm making
Right.
$55,000. I got Social Security coming in. I don't have a check coming in every single month. I'm making something different. The government doesn't know that. They're still going to charge you your Part B based on what you made 2 years ago when you was making $125,000. Okay?
Wait a minute. Now, the government, let me get this straight. The government does know it. The government doesn't care because the shift only came because I was retired.
That's
Nobody
exactly right.
retires and makes the same amount of money. I've
That's
never seen that before. Anybody who's retiring is going to make less money. So they know they just don't care.
That is true. That is true. They're not in a rush to transition you over to the proper Medicare. I'm just going to let y'all know that right now. So
Okay.
why do I say all this? Why is this important? Well, there is a form that you can fill out. It's called an IRMA form, income related adjustable income. Okay, maximum adjustable income. And what happens is this form, you fill it out and you let them know that I've had a life change, right? I retired. I have a medical situation. Um, I had a situation where I can no longer work. Whatever the situation is, you can fill out a form and let them know, hey, look at my income now. Don't look at what it was 2 years ago. I was
Right.
making $120,000. You're right. But now I'm not.
Now,
Okay.
where is this form? Where do you get this form? How
So
do you get
we can send it to you.
it? Okay.
Yeah, we can definitely send it to you. Okay. This is the first iteration of me giving everybody my phone number. Okay. So
Okay.
I'm going to tell you all guys my phone number several times over this call. My phone number is 703-932-5057. And again, my name is Mike Lee, kind of like Spike Lee, but Mike Lee.
Yes, sir.
All right. 703-932-5057. All right. So that is part A and B. Part A and B takes care of 80% of your medical situation. It's technically just part B. Part B is going to take care of 80% of your medical bills. The other 20% is your responsibility. Okay, so there are some gaps in Medicare that we naturally fill in. And some people just don't even know that there are gaps that they need to fill in. So some people are way behind on some of this stuff. Okay, so let me make it plain. Let's say somebody is battling cancer and they have to go to chemotherapy or what have you. Let's say the doctor's bill is $100,000. Medicare is going to take care of 80% of that. They're going to take care of the $80,000. The other 20% is your responsibility. So they take care of 80,000. You have to figure out a way to take care of the 20%. Now, how do most people take care of the 20%? They have what's called a Medicare supplement plan or a Medicare Advantage plan. Okay, all the commercials that you see on the television,
Yeah,
I
I've
don't know
heard.
which
Right.
one.
Yes, sir.
Humana, Aetna, United Healthcare, Sigma, I mean, Devoted. Like there's a bunch of companies out there, and we work with all of them. The reason we work with all of them is because we want to make sure that you have the very best thing that you are eligible for and entitled to. Okay. All of the commercials that you see, it's really only two options.
Okay.
Two options, not 10. I know it sounds like 20 different options. It's really only two options that you have to fill in that 20%. Okay. I'm going to start with what's called a Medigap plan. Okay. It's called a Medigap plan. The way that the Medigap plan works, again, A and B is taken care of the 80%. The way that the Medigap plan is you will get insurances to fill in those gaps. You will get your own personal dental, vision, and hearing plan, individual dental, vision, and hearing plan. Okay. You'll get your own drug plan. Okay. Drugs, prescription drugs, obviously that's an expense. You have to get your own prescription drugs plan. You have to get your own supplement plan. The most common supplement plan that is out there is called Plan G. G stands for
Yeah.
good plan, right?
Yeah.
A Plan G. Okay. And what that is going to do is that is going to make sure whenever you go to the hospital that everything is taken care of. Okay. Now, with this Medicare supplement plan that I'm talking about right now, it is typically in the DC area, it's typically going to add an additional $150, $200 to your monthly amount of 206. So if you're paying 206 for your Part B, you might add another $150 to $200 to that to make sure that your dental, vision, hearing is taken care of, make sure your prescription drugs is taken care of, make sure anytime you visit the hospital or the doctors, all of that is taken care of. Okay. Um, Again, that is called a Medicare supplement plan. How do you know if you have a Medicare supplement plan? Well, you're going to have four different cards. You're going to have your red, white, and blue card. You're going to have a prescription drug card. You're going to have a dental, vision, hearing card and a Plan G card. So you're going to have four different cards. Okay.
Okay.
That is called Medicare supplement or Medigap. The other option is called Medicare Advantage. Okay. Now, with Medicare Advantage, what people really like about it is it bundles everything up into one little circle. Your dental, your vision, your hearing is going to be in the same plan. Your prescription drugs is going to be in the same plan, as well as the supplement to take care of the additional 20%. It's all wrapped up in the same plan. Okay. How much does the Medicare Advantage plan usually cost? Most times it's at no cost, $0, maybe $9 a month. So you pay your 206.50 plus $0. So you 206 for the month, or 206.50 plus $9. You're talking about $215 for the month, right?
Okay.
People always ask me, well, look, if the Medicare supplement plan is going to add an additional $150 to $200 on top of it, and this ain't going to add nothing but $0 or $9, why would I ever get the Medicare supplement plan? And what I try to teach people is, listen, whoever tells you that one option is the only option, they are completely wrong. Here's the difference. With the Medicare supplement plan, where it's a bunch of different things that you're getting individually, you only have to pay that $200, extra $150, $200 per month, but you only have a $288 deductible one time. So if you're somebody who has a lot of medications, you go to the doctors all the time, you might be battling something, cancer, heart attack, stroke, you're always in the hospital, it might make sense for you to get a Medicare supplement plan.
Okay.
The reason is because, yes, you got to pay an extra $150, $200, but all you're going to pay is the $288 for your deductible and everything else. It don't matter if you have $1 million worth of bills. It don't matter if you got $200,000 worth of bills. You're only going to pay that $288 and whatever you're paying per month. Okay? So that's for people that's battling things. They're always in the hospital. They
Right.
always paying extra money for this and always, you know who you are. Okay? For the Medicare Advantage plan, that is for people that are healthier. They might just go to their primary care physician. They might go to a specialist here and there. They might have basic medications. They might be taking medications for high blood pressure, diabetes, high cholesterol, thyroids, or whatever it is. Okay. What they like about it is it's $0 a month. What people don't like about it is you have what's called copays.
Right.
To go and see your primary care physician, your copay is usually $0. But to go and see a specialist, your copay might be $25, $35, $45, right? So you want to go see your cardiologist, $45. You want to go see your optometrist, $45. You want to go see this person, $45. Okay. So you got to decide what makes sense for you. Don't just wrap everybody in one category. You got some people that's always down at the doctors. Might be a Medicare supplement plan. Okay. You got some people that's just healthy, just going, they see their primary care physician, they take a couple medications. It might be a Medicare supplement or a Medicare Advantage plan. Okay. I'm here to help you figure out what makes the most sense. What we do when we talk is I take your doctor's information. I get all your doctors. I want your primary care. I want your cardiologist. I want your optometrist. I want everybody because I want to make sure that it's covered in your program, in your healthcare.
Yes, sir.
I take every medication that you take. I don't care if it's calcium. I don't care what you're taking. I don't care if it's allergy medications. I want to know everything that you're taking so I can make sure that it's covered in your plan. Okay. There are a lot of people that don't realize, even if they have a Medicare supplement plan or whatever it is, there's a lot of people that is overpaying for their drug plan because there's a lot of changes in the drug coverages. There are some people that was getting their medications for free last year, and this year they're going to have to pay because the drug coverages have changed. But with that, there are also drug plans that people can get that might cost $4 a month, $9 a month. I got a client who was paying $76 a month for their drug plan. I went and got the exact same medications covered, and they're paying $4 per month.
Amen. Thank you.
For the exact same thing. Okay. Those people that have the Medicare supplement plan, they have plan G. They might even have plan F, right? Those people that have the a la carte, I got my own drug plan, my own dental vision hearing. When you get that, all the plans are the exact same. So if somebody has a plan G is a plan G is a plan G is a plan G. There's no difference whether it's from Humana or from Aetna or from Sigma or from whoever else. The plan Gs are the exact same. The plan Fs, which you had to have before 2020, by the way, if you have a plan F, congratulations, you made the cut. But those plans are the exact same.
Okay.
However, the price continues to go up. So if you got your plan G at age 65 and you're age 75 now, your price has risen. It's gone up every single year. Did you know that you can look and say, hey, look, I got this plan G. Is there anything out there that's cheaper? Literally yesterday, I got a client who is paying $330 a month for their plan F. I go in, I put it in my software, which that shows me everything that's available. There's the exact same plan for $201.
Okay.
Why we overpay? Why is it that our community is always the last one to the show? Why is it always us that's overpaying?
Always.
Dude,
Always.
you see what I'm saying? And the reason is because we don't have professionals that's willing to slow down, right? I'm busy. Look, Reverend Black, I'll be honest with you. I've been doing this for over a decade. I don't care what people do.
Amen.
I love everybody. But if people hear this call and it goes over their head, that is completely up to them.
Yes, sir.
However, you're going to keep running into these situations where you the last one to the show. Everybody got this Medicare Advantage plan and all these things, and you just don't know, right? So that is how that works, okay? When you get the Medicare Advantage plan, it takes care of A, B, as well as D, which is your drugs. So you get drugs, dental, vision, hearing, you get everything that you need all wrapped up in that plan, okay? Now, the last thing that I want to mention, one of the last things that I want to mention, it's two things that I actually want to mention. A lot of people say, well, what's going on in 2026? Well, I'm going to give y'all some alarming news. United Healthcare and Aetna, two major companies, they're leaving the state of Maryland for 2026. Their Medicare Advantage plan, you know how I was talking about the package, the bundle deal?
Yes, sir.
Removing that in the state of Maryland for 2026. There are people on this call right now, Reverend Black, I'm telling you right now, because I know this for a fact. There are people that are listening to this and they're saying, what? United Healthcare is leaving the state of Maryland? Yes, United Healthcare is leaving the state of Maryland. Yes, Aetna is leaving the state of Maryland. If you have a Medicare Advantage plan through them, you are going to be one of those many people that go to the doctors January 1st. You're going to do everything the same. You're going to see your doctor. Hey, Dr. Jenkins. Hey, Dr. Such and such. And you're going to get a bill for $1,175 because
My
they
God.
doctor bill and they didn't take care of the medications. Okay. Again, it is imperative to know people before you need people. I'm going to give you my phone number again right now, so you guys know who you can call to make sure your United Healthcare plan is not leaving. Is every single United Healthcare plan leaving in the state of Maryland? No. If you have, if you're a federal retiree, your healthcare plan your United Healthcare plan or Aetna plan may or may not be leaving. You still need to talk to a professional, right? There are some organizations that have worked out a deal. I got some clients, they have United Healthcare through Verizon or AT&T, and AT&T worked out a deal to say, hey, we working with United Healthcare, don't touch our plans or any of that stuff. So you need to talk to somebody to make sure that your plan is still going to be around. Okay. We gotta have these conversations. Okay. The other thing, I want to give you guys some good news. I know I just gave you guys some bad news, but I want to also give you guys some good news. For those people that are maybe you got TRICARE for life. Everybody says, oh, I got TRICARE for life. I'm good. I'm good to go. Guess what? I got some good news for you. Yes, you are good to go, but there are other programs that are tied around TRICARE for life that you may be eligible for and entitled to. For example, there's something that's called a $100 give back. What do I mean by that? If you got TRICARE for life, that means instead of you paying $206.50 per month, you might be eligible to actually pay $106 per month.
Amen.
$100 towards your Part B every single month. Okay. They'll also give you a $75 health savings card. What does that mean? That means if you are going to go to the grocery store, you can take the first $75. You can take the first $75 and scan, and it will come off of their account, not your account, because you're trying to eat healthy.
I
They're
know
all
make it go
preventative
away.
measures. Okay. So if you're a federal retiree, if you are prior military, if you go down to the VA, if you go down to Walter Reed, I know I got a lot of clients to go to Walter Reed. If you go down to the VA or any of those things, you may be eligible for these givebacks. You need to have a conversation, okay? And there are several companies that do it, okay? So I'll be able to walk you through that. Let's say you're on Medicaid, okay? Medicaid means that you're getting aid from the state to pay for your Medicare. There are givebacks that you could be eligible for, $100, $188 per month that they will give you to help you out, okay? So that is a lot of information. That is a lot of information. And again, I want to make sure that you guys are aware of some of the things that's coming down the pike. Okay. Any questions for me, Reverend Black? I know I'm rambling.
No, Doc, I don't want to interrupt this knowledge. No, you no, God knows. I mean, I'm sure there's going to be a lot of. I'm thankful that you're giving out your phone number. Um, no, no, you keep going. We're gonna run it all the way to the end. I think we got about 8 minutes, 8 minutes left. So let's keep going, man, because people need this information. I have no questions.
Excellent. Excellent. All right. So here's another thing that we need to know. Most of us don't know this. All right. Y'all know anytime I come on here, I'm talking about the things that nobody's talking about. All right.
Amen.
When you go to the hospital, let's say you have an emergency, you end up in the hospital, you're in there for 6 days, 7 days, 8 days. Most times, the Medicare program that you have, Medicaid program that you have, whatever it is, most times they are going to require a $407 deductible for the first 6 days that you're in the hospital. Retirees, they gotta make
Okay.
their money too. They gotta make their money too. Okay. $407 deductible for the first 6 days that you're in the hospital. If you got Blue Cross Blue Shield, it's $385. If you got Humana, it's 407. If you got United Healthcare, it's 407. If you got Aetna, it's 395. Like it's different per company, but they're asking for a deductible for the first 6 days that you're in the hospital. From day 7 through 90, typically is free, or I'm sorry, at no cost. It's not free because somebody's paying for it. It's at no cost for you. Um, but this is what a lot of people do. There is something that's called a hospital indemnity plan. Okay. And what that does, this is something that we provide for people that's over the age of 65 or under the age of 65. It doesn't matter. That will pay that 407 for you for those days. It will pay the 385 for you. So you ain't got to take that money out of pocket. If you can't afford $2,500, $2,400 for going to the hospital, then you need a hospital indemnity plan. It costs you $20 a month or something like that. But it takes care of that issue that you will have. Okay. Another thing that people need to know. Did you know 50% of males will catch cancer? 33% of females will catch cancer. It is what it is. Those are the numbers.
Yes, sir.
There are cancer plans that you can get, individual cancer plans that you can get that will pay you a lump sum when you catch cancer. Why is that important? Well, let's just say if 50% of people, 50% of males are going to catch cancer, that means that if you're standing in a room of 10 men, 5 of them are going to have an issue.
Amen.
All right. Now, with that, I tell people, look, people survive from cancer all the time, but it ain't cheap.
Right.
It ain't free. The deductible for the common cold is not the same deductible for cancer. You're not
Amen.
going to your primary care physician for cancer. You're going to a specialist. You got to go down and see Dr. Gupta, the specialist. And guess what? That costs money.
Yes,
Okay.
Lord.
The other thing that the Medicare Advantage plan does is it puts a cap on the amount of maximum out-of-pocket money that you can spend. This year is $7,550 for most plans. The maximum that you can pay out of pocket is $7,550 if you have a Medicare Advantage plan. Okay. Guess what? A lot of that comes because you got to pay for the, staying in the hospital, that 407. You got to pay for the specialist. You got to pay for this. You got to pay for that. If you have a cancer plan, they're going to give you a lump sum, $15,000, $20,000, $30,000, whatever you want. to be able to take care of some of the things that you need to take care of. These are very inexpensive as well. $20 a month, $30 a month, right? There's also something that's called a heart attack and stroke plan. Okay. It works the exact same way. If you never had a heart attack and stroke, guess what? You can get a plan where if you have a heart attack or a stroke, they're going to give you a lump sum of money, $20,000, $30,000, because we need the resources to be able to overcome a lot of these things. But what happens is we just depend on, hey, I got some money set to the side, I got this life insurance policy, but what happens if you don't die? Life insurance is built if you die.
Right.
It's built for your family. What happens if you don't die? Right? So those are some of the things that I really want y'all to understand. Again, I'm going to give you guys my phone number. Um, I am very, very busy, and that is a good thing.
Amen.
However, I am not too busy to take a phone call. I am not too busy to call you back or text you back. Okay. My phone number, one more time, maybe one more time. I might give it to y'all one more time, but my phone number is 703-932-5057. And again, my name is Mike Lee, 703-932-5057. And Reverend Black knows, look, I am the type of person that if you got something good, I'm gonna be the first one to tell you, look, mama, don't change this. Keep
Right.
this exactly how it is.
Amen. Amen.
It's exactly, don't let nobody come. What you got is locked in. This is good. But I'm also going to be the first one to tell you, hey, you might want to make some adjustments. This is old and obsolete. I know you got TRICARE. I know you're a veteran. I know all these things, but there's other resources that you can get. You're eligible and entitled to more money here. So
Well,
that's
Doc, they are waving their hands, jumping up and down, saying my time is up. The team will get in touch with you. We're gonna get this out there to the people as soon as possible. We're gonna have this up, try to have it up at the beginning of next week. We're gonna wrap this up. I'm gonna work on it when we get off here. And whatever the team does, the slicing and dicing and all that to make me look good, you're fine. They got to do something with me, and so, God bless you, man. We'll talk over the weekend because I do have some other questions about some things you mentioned. So I'll be calling you either this evening or tomorrow. You and the family stay blessed. Thank you for giving out your personal number so that people, because you're going to get a lot of calls from this, because there were a lot of people wanted to see this when I was talking about it this week, and so we're going to get it right up to the public. So because Doc, this is something that's going to, unfortunately, if they don't get ahead of it, it's going to devastate some people. It just is. It is what it is. And so we want to get it out there. You and the family, Mr. Lee, you guys stay blessed. We'll be talking real soon.
Yes, sir. Last 30 seconds. On Tuesday, the 4th, I am going to be having a workshop, a Medicare retirement workshop. It is going to be virtual. Okay.
Okay.
There's going to be a 12 p.m. Zoom call, and there's going to be a 7 p.m. Zoom call. Reverend Black, I will get you the information for that. There's an Eventbrite registration link that I send out to you. But anybody that want to get on that, hop on. I'm going to be educating people.
All right. Send it to me immediately, as quick as you can so that I can get it up as quickly.
I'll send it right now. Yes,
All right,
sir.
Doc. You and the family stay blessed, man.
Likewise. Take care.
Appreciate the help.
All right now.
All right.
All right. Bye.
Bye bye.